Intestinal malrotation is a condition that begins before birth. During early development, the intestines grow outside the belly for a short time, then move back inside. As they move back, they usually twist into their normal shape and position. If this twisting doesn't happen properly, the intestines are in the wrong place. This is called malrotation.
When the intestines are in the wrong place, they can twist around themselves. This twist is called a volvulus. A volvulus can block blood flow and cause serious damage to the intestines. About 1 in every 500 babies in the US is born with malrotation. 75% to 90% of these children are diagnosed by age 1. Some children are not diagnosed until later in life. Other problems linked to malrotation include belly pain, poor growth, and malnutrition.
Malrotation affects boys and girls equally, but more boys show symptoms in the first month. About 70% of children with malrotation also have other birth defects, such as problems with the belly wall or digestive system, heart defects, and liver or spleen problems.
Some people with malrotation never have symptoms. Others may have symptoms at any age. If a blockage or twist happens, symptoms may include vomiting green or yellow fluid, belly pain, swollen belly, fast heartbeat and breathing, or blood in the poop.
If malrotation or volvulus is suspected, doctors may order these tests: abdominal X-ray to check for blockages, upper GI series, uses a special drink and X-rays to see the shape and position of the intestines. Barium enema puts liquid into the rectum to show the large intestine on X-rays. Or ultrasound uses sound waves to see the intestines and blood flow.
Volvulus is a life-threatening emergency. Patients with volvulus will need emergency surgery. Treatment starts right away. IV fluids to prevent dehydration, antibiotics to prevent infection, a tube placed through the nose into the stomach to remove air and fluid.
Surgeons untwist the intestines and check for damage. If the intestines are healthy, they perform a procedure to prevent twisting. The appendix is usually removed because it is not in the usual spot.
If part of the intestine is badly damaged, it may be removed. Sometimes a temporary opening is made in the belly to allow poop to leave the body while the intestines heal. Later, the intestines are reconnected.
If surgery is done early, most children recover well. If a large part of the intestine is removed, the body may not absorb food and fluids well. The child may need long-term IV nutrition, TPN. The risk of death is higher if part of the intestine has died or if the child has other birth defects.